Arizonans could decide at the ballot box this fall whether they have a right to refuse medical treatments required by schools, government, or employers. It's a reaction to the COVID pandemic. Right now, does this proposal go too far? Also on Sunday Square Off, Homeland Security Secretary Kristi Noem is fired. What, if anything, will change under her likely replacement, Senator Markwayne Mullin? Does President Trump's war in Iran put Arizona Democrats and Republicans in a bind? Republican County Recorder Justin Heap accuses the Maricopa County Board of anti-Republican bias. There was just one problem with his claim.
One of the things I think is going to be a positive side effect of this bill, if the people of Arizona decide to vote yes on it, is that it will actually reduce that hesitancy because you won't see the government being overbearing. We as humans, naturally, if you tell us not to do something, we get kind of pissed off and we say, well, we're going to do the opposite of what you say anyway. I think this is a win for vaccine uptake.
A win for vaccine uptake. That was Republican State Representative Nick Cupper of Surprise. He believes his legislation that would give Arizonans a constitutional right to refuse medical mandates, like vaccination requirements, could actually reverse the alarming decline in vaccination rates. Arizonans could vote on Cupper's proposal in the November elections. And a right to refuse law could have a significant impact on the health of Arizonans. Joining us to discuss the ballot referral is Will Humble, former public health director for the state of Arizona, now executive director of the Arizona Public Health Association. Will, welcome back to Square Off.
Morning. Thanks.
I need to let viewers know Representative Cupper was invited to join us, but sent word that he would be with his children today. Now, Cupper's proposal is halfway to the November ballot. The ballot referral was passed by the Republican-led House this past week in a party line vote. Now it heads to the Republican-led Senate, where passage will put the measure before voters in the fall. Democratic Governor Katie Hobbs does not have the power to veto ballot referrals by the legislature. Well, let's go back to what Representative Cupper said in that soundbite. Your reaction: could his right to refuse actually reverse declining vaccination rates?
I have no idea why he thinks that that would be the case. It's super counterintuitive. Here's the thing. Like, we have school vaccine requirements in place in Arizona, and if a parent is really anti-vaccine, they can sign an exemption and send their kid to school anyway. But the real value for those school requirements are for those families, and there's lots of them, whose kids fell behind. They weren't on the vaccine schedule. They're not anti-vax, but they haven't got their kids up to speed yet. They take their kid to kindergarten or preschool, and the staff is like, oh, you're behind on these vaccines. I know. And so they go and get their kids vaccinated. So that's how the school vaccine requirements keep higher levels. You remove that mandate, that prompt, that nudge no longer exists, and we have even faster erosion of vaccination rates.
Let's break down the measure that would establish a constitutional right for individuals to refuse medical mandates. Hospitals, other healthcare institutions, as well as governments and schools would be covered by this. We have freedom of worship, freedom of speech. Why not freedom to refuse medical mandates?
Well, here's the thing. Like, this proposal, if the voters were to approve it, is far more than just getting rid of the school vaccine requirements. It stops schools and it stops both schools and county health departments from actually intervening when there is an outbreak. So you lower the vaccination rates, you make those diseases more likely to circulate, and then you take the tools away from the county health departments and schools, the only tools they have to mitigate those. And so I can give you some examples if you want.
Well, let's talk about unintended consequences. For example, lice outbreaks in schools, very common.
Scabies and lice. Lice is more common than scabies. So right now, your kid's in preschool. Preschool says, hey, your kid has lice. We'd love to have Dylan back. Please bring her back as soon as you've treated the lice. Maybe even tomorrow with the shampoo. That's a medical treatment. So school could no longer say, or, exclude kids with lice or scabies. It doesn't spread disease. It's super gross. But there's other things where the diseases would continue to spread, and counties and schools would not be able to intervene.
And talk about counties overseeing restaurants.
Right, exactly.
So
Salmonella, Shigella, Campylobacter, E. coli. These are all foodborne illnesses right now. when a food service worker gets an infection with one of those diseases, the county health department comes in and says, hey, you've got an infected service worker with salmonella. We suggest they go get treatment before they come back to work in food service. Counties would no longer have that authority because you're compelling the antibiotic treatment before you come back to work. Same with measles, mumps, whooping cough, pertussis in elementary school. Like, it would stop the intervention measures for all of these things. And if you read the statute itself, it talks about medical freedom. There's nothing in there about removing the ability to slow these outbreaks and making them more likely because you've lowered vaccination rates.
And go back to measles, because we're in the midst of a pretty serious measles outbreak here in Arizona and around the country.
Yeah.
How would that be affected, that treatment of it?
Yeah, so right now, if this is a little complicated, but let's say there's a kid who gets measles in a third grade classroom. Okay, so a county health department goes in and says, oh, where are the unvaccinated kids in this school? They're the most susceptible. We're gonna ask them to go back, get their vaccine immediately. If you get the vaccine within 72 hours, it can prevent the disease. Right now, that's what happens. You wouldn't be able to do that. Both schools, county health departments couldn't send that kid out and ask them to get the vaccine before they come back to school. They would, because this constitutional amendment would prohibit that action by the county or the school.
So the word medical mandates sounds like a big word, but the way you're describing it can be very narrow in some ways.
Well, they like counties and schools, and they don't use this authority willy-nilly. It's not something they want to do. It's targeted ways where they have to use that authority to slow the spread, whether it's a foodborne illness in a restaurant, whether it's whooping cough in a preschool, whether it's measles and mumps, which are a lot more rare, becoming more common, or even things like we talked at the top about scabies and lice. I mean, like, is that, I mean, that's why I was hoping he'd come on the show, because I could ask, like, dude, is that really what you want?
It's unclear. It is a response to pandemic era restrictions. COVID restrictions, masking, vaccinations. How has the pandemic changed the way you do your job? Public health officials, public health agencies do their job. What are the lessons?
Really, if you go back to the root of it all, I think the most damaging thing has been the loss of trust in institutions. Like, that's where I see the biggest problem. And it's happening on both sides now, because on the center left, they have a great distrust of the Health and Human Services Department and CDC now. So you have, during the pandemic, loss of institutions on center right and right. Now you have loss of institutional trust on the other side. And that leads to the distrust of everything, really.
And gives rise to proposals
Like
like
this.
this one. Have public health officials, in your mind, done enough to reckon with that?
No, we've got to do a lot better with being able to communicate in the ways that people get their news today, through social media and other mechanisms. We, like in the public
pretty
health,
challenging.
I know. We're in the public health world are stuck, I think, in 10 years ago, the way that we communicate, and that does need to improve.
Is there a larger issue, just the sense of, this reflects a breakdown in a sense of community? I don't think we were around, back during the polio vaccine.
Yeah.
But
Well, if it goes to the other part of this, of why why the erosion in vaccines is happening, is because, like, my parents' generation, my mom's generation, like, they knew what these diseases did. And when the vaccine came, it was like, oh my goodness, let's get those vaccines right away. Vaccines have, by and large, eliminated many of these childhood diseases that are vaccine preventable. Now, parents don't see the diseases, and so they see the vaccine as the threat rather than the disease itself.
So, what if this right to refuse referral makes it on the ballot?
Well,
Do you think it could pass?
It depends. Like, does the word get out about what this really does or not? And my fear is that Secretary Kennedy and his friends, who have a lot of money, could use this as an example to move this forward and fund the Yes campaign for this. And here we are in public health with, like, no money, trying to argue, like, this is what it really does, folks. Is this what you want? And that's difficult when you've got empty pockets.
All right, got to end it there. Will Humble, thanks so much for joining us.
My pleasure.
When we come back, President Trump fires his DHS secretary. Will anything change at DHS? But first, does Maricopa County Recorder Justin Heap know how our elections are run? A wild claim has people scratching their heads. And 12 Plus is the streaming home of 12 News. You can see all our Sunday Square Off coverage. Download 12 Plus on your Roku, Fire TV, and Apple TV devices right now. And stay with us.